I'll start that again. Sorry about that. I'd like to call the meeting of Dunn County Committee for the Neighbors to order. Here we are, Thursday, 12:15. And we do have a quorum. Sean Breslin is on Zoom and Don Keeter is on speakerphone. So we've got three. So I guess we can proceed. So the first thing is call the roll. I just explained that. Approval of the minutes. Sean or Don?
I move to approve.
Back on the phone. Did I miss anything?
Well, we're just approving the minutes and I'd like to have a second from you, Don.
Oh, okay, I'll second it then.
Okay, thank you. First and second, do either of you have any corrections or additions?
No, it looked good.
Okay for you, Don?
No, it's okay with me.
Okay, all in favor then say aye.
Aye.
Okay, record shows that both committee members voted in favor. There is no public comment. We have Chris Corpola with us too and Scott Knopperfeld. And number 5, introduction of department heads. We will postpone till next time. Is that correct?
Yes,
Okay.
the individual who's gonna come today had to take their daughter to an appointment because they didn't want her driving in the snow. So we will postpone till next time for that.
Okay, then, so let's move on the agenda to number 6A, Quality Assurance Steering Committee updates.
All right. So Quality Assurance Steering Committee met last week on Thursday. I actually was not in attendance as I was at the Leading Age Wisconsin board meeting, but I did get an update from my team members that were at the committee meeting. Most of it was status quo. We did talk about our safety committee as the primary subcommittee that we talked about. We went over the most recent meeting of the safety committee, which focused a lot on chemicals. We have tried to reduce the number of chemicals we have so that it's easier for staff to know how long things like dwell times for chemicals, as well as to avoid mixing of chemicals. We did have an instance this past summer of a staff member having issues mixing 2 chemicals, which is a dangerous situation. So we are trying to avoid that as best as possible while still having the proper cleaning chemicals available to staff. So that was discussed, but everything else was pretty much status quo with quality assurance.
Thank you. Any questions, Sean or Don?
Nope.
No questions.
Okay,
6B.
right. The next one I'll hand over to Chris for the employment activity report.
Good morning. Can everybody hear me?
Good morning, Chris. That's good.
Good morning. So this one I combined October, November, since we did kind of like the tail end of October for our meeting last time. So it's a little higher numbers than normal, but I wanted to capture both months. So the types of recruitment kind of were as normal. The websites, NeoGov, Indeed, we did do job service this time around. So the number of direct hire interviews was 13, or total interviews for that period of time was 24. And the positions offered were 13 and positions accepted were 13, and one was higher than a step 3. And that was a returning staff member who needed no training. So she did ask for a little more. The majority of the hires this time around were for the PM homemaker shifts. So those are in a very good spot right at the moment. Resignation reasons, kind of your, our standard reasons. Somebody went to Mayo, somebody went to St. Clair Hospice. We had a CNA graduate from the nursing program at UW-Madison and then took a job with the UW health system. She enjoyed Madison. We had a part-time homemaker left due to school and scheduling issues. Then we go down to open positions, and those were, up and down for, the leaving and people onboarding. We don't leave the absences, 9, and the majority of those are part-time students away at school. No lost time for work comp, and then for number of hours or shifts missed for October, November for COVID-19. That's if somebody calls in with a symptom that could be potentially COVID or a symptom of COVID, even though it's not COVID, was 97 shifts, or roughly kind of 780. And a lot of this is kind of a guess because some people are scheduled 8s and some people are scheduled 12s and some people are scheduled 10s. So it's kind of a ballpark average, but we did see a little uptick in that. Anybody has any questions?
Don or Sean, do you have any questions?
Chris, are the COVID issues straight
Take one
COVID or
moment,
are they
Don.
flu and RSV?
No, it's not all COVID positive. I mean, if somebody has a sore throat, that's a symptom of COVID, but that could be kind of the everyday, seasonal junk. So,
Don, did you hear that question?
No, I didn't. I couldn't hear that. Yeah.
Did you hear the response?
No.
Have you been able to hear Chris's report? Oh, okay. Sean, could you repeat the question, please? I didn't catch it either. Don was on the phone here.
I was just asking if it was straight COVID or if it was flu and or RSV that was causing the issues. Chris gave the answer. It could be a combination of everything.
Yeah, thank you very much. Chris, I want to thank you for, the reasons for resignation. Seeing where they're going and so forth really makes a difference. And
sometimes when
you're gone.
sorry. And sometimes when people leave to go to Mayo, they could be a recent graduate and they've had their eye on med surge since they were doing their clinicals. It's not that they dislike us. We just lost a nurse that went to hospice, and all throughout her nursing program, that's where she wanted to be. So it's not a negative sometimes when people leave. They just, they're educating themselves and, they wanted to explore a different part of nursing. So.
Okay, thank you. And this is the time where I ask about the CNA course.
So we have had some movement on the CNA course. So I had the individual from the outside agency that does CNA courses come into the neighbors and look at our space. That's probably a week or two ago. We had been trying to scheduling it, but she had been ill, so she couldn't come into the building for quite a few weeks. So we did a tour of the neighbors, and then she looked at the space that we would use for the training program. That has to be approved by the state of Wisconsin. It has previously been approved when we had our own program years ago, but since then, some of those requirements have gone up and they're being pickier about those spaces now. So she was kind of concerned about a little bit of the space. And since it is technically in one of our households, they have issues with it being disruptive to resident households. But since it's in a closed household, I think we could argue it. So she's now working with contacting the state people to see what their thoughts were on that space. So, and that would be whether it was them doing it or us doing it too. So we could have some issues with that, but we've also kind of considered a couple of other places that would be potentials as well. So still working on it. It is having progress now. The company has actually been to the neighbors and looked at it, and we're making a little bit of movement on that.
Okay, thank you. Yeah. Yeah, let's move on to 6C then.
Sure. Nursing management update. I put this right after the employment activity report since it is employment related, but a little bit more specific. So we did hire a person to fill the central assistant clinical mentor position. We hired Rebecca Proudlock. You actually all met her a couple of months ago when she came to introduce herself as one of our MDS nurses. So we promoted from within for that position. So she started in that position a few weeks ago, is still working with the other ACMs to learn all of the things that that position does, but is doing well thus far. So we are excited about that. And then also in nursing management, Paula McClellan has decided to retire. Her last day was actually last Friday, the 9th of her retirement notice. So she is officially retired. So we have posted the clinical mentor program. We have had a couple of applicants, but we just posted on the Director of Nursing Council for the state of Wisconsin's website. So we're hoping to get a couple more applicants from there before starting doing interviews for that position as well. Any questions on either of those updates?
No, I'm good. Thank you.
I'm okay.
Okay, I do have a question that's related to employment. You're doing a survey. I'm just wondering where that's at and.
Yep, so HR has worked on compiling those survey results. So they all of those survey results were sent directly to HR to hopefully get more responses and things like that. So Jenna and her team have compiled those, and I know that in the next couple of weeks or so, we will be having a meeting to kind of go over and discuss those. We did not get as many as we had hoped. So we are kind of hoping for a couple more to trickle in. But at this point, they have stopped trickling in, I believe.
And just to confirm, that included everybody, right? Not just nurses
Yes.
or, okay.
Everybody at the neighbors, anyone with an NDC cost center as employment.
Oh, okay,
Mhm.
okay. And just to remind the rest of you that you and Jenna and Chris sometimes have been getting together and brainstorming and talking about different things. You still doing that?
Yes.
Okay, thank you. 6D then.
All right, resident referral report. We actually don't have a written report for this month. The individual who prepares that report has been out ill, so we don't have the written report. But I can give a verbal report. We have had similar numbers of referrals, so we're still seeing a lot of referrals as we have been for the last couple of years now. Directly related to many nursing homes not accepting referrals due to staffing, COVID, all the different reasons. We have seen roughly 100 to 150 referrals a month is the average, which is crazy. That's a lot of people that there aren't finding locations for them to go. So it's definitely hitting our healthcare industry as a whole, not just nursing homes. It's causing the hospitals to struggle because then those individuals sit in the hospital. So it's putting a very large strain on the healthcare industry right now. In terms of accepting admissions, we have started accepting admissions, but only to our open households. So we have not opened Fireside or Arrowhead yet, but we have been filling the open beds in the other households that would not add any required staff to fill. So if we've had people discharged or if we've had people pass away, that's had beds open. We have filled those, but we're maintaining right around that 100. I believe our census today is 98.
Okay, and you mentioned that staffing is a difficult thing. Now, just for information, you were on a Zoom with directors of other publicly owned nursing homes?
Yes,
correct?
so that was, I'm kind of going to talk about that more later with the financials, because that was directly related to rates. So it was led by one of the leading age Wisconsin's financial people. So it was more finance related. We didn't get into
Okay.
the staffing stuff in that.
Okay. Just to make sure everybody knows that there's lots of communication going on always between you and your colleagues and so
Yes.
forth, which is important.
Mhm.
So with the 98 or so that we have now, how's the overtime going and the mandated? Do you have to mandate?
We are not mandating very often now. Today would be one exception, as if people don't show up due to snow, we have to have people stay. That's always a hard thing when it comes to weather, as we can't send people home if people don't show up because of the weather. So that is always something that's we have to manage, but we actually are doing okay right now with the amount of households we have open for having staff. Sometimes we even have 1 or 2 extra staff on shifts to also help get things done. But not enough to say we can open another household yet. So, but it is giving some of our staff a little bit of breathing room because we have extras on most shifts at this point.
That's good to hear. Any comments or questions, Sean or Don?
No, I'm good.
Oh,
Go ahead, Don.
Just a general question. Does the employment picture, does it seem to be improving a little bit, or is it still pretty desperate?
I would say it's still pretty desperate. And I think that that is something that I don't foresee changing. There's simply not enough people to that are able to take care of the number of people that need nursing home care, and that's across the nation. So I don't see that changing. I think it's going to be a desperate situation for quite a while. We've made changes that have made internally not as dire day to day, but in general, I think the employment outlook is bleak.
Thank you. And Sean,
Thank you.
Sean, could you hear Don's question?
Yeah, I did.
Okay, thank you.
Mhm.
Just a comment on employment. I have a relative that's in a nursing home in Minnesota that was doing fairly well. It was a small town, and then it got purchased
Mhm.
by a private company, and pretty soon most of the people were gone that my relative knew. I went down to a 2-star, and now it's a 1-star, and they can't transport people places because they don't have transportation. They're doing all pool help now,
Mhm.
and I don't know, and they were going to close it, and they even found a place for my relative to go. And then they said, "Oh, no, we're not going to close it." So evidently they had a sale probably, and it didn't go through. So it's really tough. But those are 1- and 2-star places even, they're having trouble. And we have 5-star, which is just amazing. I was looking around. You can look at the CMS website and it'll tell you how many stars the places have, and we're doing just amazingly well. So, okay, I'll get off. I'll stop.
Mhm.
Any further questions on that part before we go to facilities? Okay, Scott.
Good morning, everyone. Well, we had
Morning.
November 1st, we had the West Survey. Sure, Carmen has it on here to give you more information as far as the nursing part, but for facilities, we came out with 2 sites on it. One was our oxygen room, that there ended up being more than 3,000 cubic feet of oxygen stored in that room. Once you get over 3,000 square feet, you can't have any of the plastic supplies for oxygen stored in that room. So what we did was downsized, went back down to under the 3,000 cubic feet so that we can still have the stuff stored in there. Brings us back into compliance there. If there's ever a need for more than the 3,000 cubic feet, we'll take precautions on that so that matters, so that it stays within compliance. The other thing was one of the resident rooms, the door to the resident room needed to be adjusted so that when the door was open, it would drift shut by itself. So that took a minor adjustment to get that taken care of. So minor sites. We had some things that the engineer did mention, some informational things. So we're looking at those also to take care of, but those were not sites. So did pretty well on that survey, I believe. Aside from that, I got Brady is now certified for refrigerant handling. So he is working with Dostal Geothermal on our system. He's learning a lot working with Dennis. I have one of my other facility technicians that is working on getting certified also. With that, I'm transitioning into having county staff work on the heat pumps to save that additional cost of labor from having someone else come in and work on these units. I think that will work out well. Brady and Jacob both are very enthused about this, very excited about learning this stuff and being able to work on these. So that'll help some in the future. Snow removal is going well. The snowstorm today, the staff did really well on cleaning up everything. The one prior to this, our very first one, everything went great there. So moving along well. Custodian update. We're moving toward having county custodians as opposed to contracted. Cindy is our only contracted one at the neighbors. The other position is still vacant. I'm sort of recruiting for that. So we'll have some good county custodians in that position. That's all for me today.
Sean, first, any questions? Don, you have any questions?
No, I'm good.
Uh,
The lights just came on, so I'm maybe see you soon.
Okay, that's good. So when we have the custodians, will they still be in the facility staff?
Yes.
Okay, thanks. Okay, then, thank you very much, Scott.
Thank you.
And gee, here we have the West survey from a different point of view, 6F.
Okay, so as Scott mentioned, in the beginning of November, we had the West Annual Survey. So if you recall from last, I believe it was in July was our last survey. We have annual surveys in all 3 of our neighborhoods separately surveyed by either the state of Wisconsin and or the federal government. So this one was just a state survey. We did not have any federal surveyors with us this time, as we had in the last 2 surveys, which on the life safety code side, but it was just state surveyors this time. They were here for 3 days. They look at everything in the facility. They talk to as many residents as possible. They try to talk to all of the residents, but some of our residents aren't able to answer questions and things like that. But anyone that can, they talk with. They ask them questions about their care, their life there. Do they feel comfortable, safe, happy, things like that. So that's a big part of the survey. We had a really good survey outcome. We only had 1 minor citation. It was just that an assessment was missed. We had a resident that decided he wanted to become a smoker again. And when a resident decides to smoke, obviously they can't smoke inside. But if a resident is smoking, we have to have a smoking risk assessment done. And since we normally do that upon admission, we ask residents, do you smoke? And then we do the assessment if needed. And he didn't smoke upon admission, but then decided to later. So that assessment got missed. So that was done before the surveyors left. And that was our only citation. So just having to do an assessment of his risk of getting injured while smoking, which he is capable of doing it on his own. So that went very well. And our next survey will be Central. We are currently at about 13 months from when they were here last, and they come anywhere from 9 to 15 months from their last survey. Almost all surveys are happening at 15 months right now. As every other industry, the surveyors are also short-staffed. So we are seeing them closer to the 15 months. So we're anticipating them at any point, but most likely won't see them for another month or 2 for Central. And that's what it's kind of been in our region and across the state. My colleagues in other nursing homes have said the same thing, that it's been about 15 months for those.
Okay, Sean, any questions?
No.
Uh,
Very good
Don, how
report.
about you?
I'm okay.
Okay, just, this might be the time or not, but the surveys determine in part the star rating, don't they?
Yes, they're the first part of the star rating. So there's 3 parts to it. It's health inspection or surveys, and then staffing and quality metrics. So when we submit MDSs, which are basically the overall assessments of our residents, it submits anything from falls to medications, injuries, things like that, all go into that. And then that pops out what's called quality metrics. So it just basically compares our number of whatever it might be, whether it be infections, falls, things like that, to averages, and then says how high our quality is. So those 3 things make up the star rating.
Okay, and I just have a question, or maybe a comment, I guess, is how do we get that out there? That we're a 5-star. And I know we've got some new things like the Menominee Minute and WisCommunity.com and Colfax paper. Is it possible once in a while to just, because they'll accept articles, especially Dunn County, but to let them know, and then not only people will see it, but that doesn't hurt with employment. You know, they say, oh, wow, 5 stars. Just a suggestion if
Sure.
you can never get too much publicity for the neighbors, but it's always good publicity. And wow, one citation?
One citation. And for reference, I believe the state average is right now at 6.8. And I believe the national average is somewhere in the 8 point something is the averages.
Okay, well, yeah,
Wow.
that's just great.
Thank you.
Okay, then, moving on to COVID-19 update.
Yes, so COVID-19 update, we have had some outbreaks. I believe we've had an outbreak in every single house on campus, it seems like, over the last couple of months. Fortunately, they have been pretty minor. Most have been just staff positives. We will have a staff person come up positive that had worked, and then we have to run an outbreak for that household. We have had a couple of resident outbreaks. We had one in our east building. That we had one resident that was symptomatic, tested them, they were positive, and then we test out everyone else in that household, and we discovered we actually had 7 positive residents. So the good news with that is that means 6 people were asymptomatic, which is a good thing. COVID has luckily, for the majority of the people, been very minor recently for us. So that is improvement as compared to 2 years ago when we had our first COVID outbreak and a third of the residents who got COVID passed away. So it is much improved from years past. So it still takes quite a bit of time and effort to run the outbreaks and testing and all of those different things. But fortunately, the illnesses have been much less severe.
And Sean asked a question earlier about flu and so forth.
Mhm.
In the past, did you require masks and so forth when flu was going around, or is there something like that?
Yep. So in the past, our flu vaccine policy was if you were not vaccinated for flu, so we offer the flu shot. Dunn's admitting. We offer the flu shot every year at the neighbors. If you refuse the flu shot or decide not to get it, we then required those individuals to wear masks during flu season. So our medical director would determine what season or what months were actually flu season. And they would then have to wear a mask during that time. If we had an actual flu outbreak, there was different precautions for that as well. Similar to COVID, but not quite as drastic. So we didn't have N95s or things like that. The resident would be on contact precautions, so would still need gowns, a mask and eye protection, but not the N95 like we have for COVID. So similar, but a little bit different.
Thank you. And Don, I see your picture. Can you hear us?
Yeah, I can hear you. Yep.
Hey, excellent. Worked out good. We
Yep,
just finished
no.
up with 6G COVID update. Any questions before we go on to number 7 for anything? No?
Nope.
Okay. So
Yes.
do we have Jane coming in, or are you going to do that, Carmen?
Jane is on the computer, I believe.
Okay,
Jane, oh, there we go.
can you hear
Welcome,
me?
Jane.
Thank you. I'm cozy at home today, working and watching the snow outside. Yep. Okay, so we have the vouchers. Are there any questions on the vouchers?
Sean first. No, he's shaking his head. No. Don?
No.
Okay. We can move on then.
Okay, the census, we always talk about the census and it's lower than, we budgeted for. Our year to date, these numbers are now through October, they're not through November. Our average census is 73% versus our budget of 87%. So we're off by 14%, which is, we all know that the 2 households are closed, but that does have a huge impact on the financials. So private pay is the pay source that we're most short on, and Medicaid continues to be the higher pay source. So we are getting higher Medicaid rates, so I don't think that's a bad thing. Any questions on census? Okay.
I don't hear anything, so, no.
Okay. Pool staff, that's through October as well. I did produce these, at the end of October, middle of November. So the number that you see for October pool staff is 444,000, which looks low. But as of October 31st, that was what was posted to our general ledger. So that may go up. If you compare these sheets to last month, you would notice that September's total is different because of the same thing. We've produced information for you prior to the general ledger being closed. So I update these every month to make sure our year-to-date is accurate. So at the bottom, the 2022 monthly average is $377,000 for pool staff, which is more than twice of last year. But we know that's a challenge. But that's how the numbers are playing out. Any questions on that?
Yes, Dunn,
Oh.
Supervisor Keeter?
I was just assuming that the census won't change a whole lot until the employment situation changes, right?
Carmen
That
could
is
answer
correct.
that.
Yes, that is correct. The only time that the census would change is if we were to open up one of the households, which at this point, we're waiting until we have enough staff to do so. On certain days, we have enough staff, but it's not consistent enough to do every day. So we don't want to push the boundaries of not having enough staff. So only filling to the point that we can staff every day.
Okay, thank you. Welcome, Larry. We're talking with Jane right now. We're down to the vouchers and financials.
Any
Um,
other questions on the pool staff? Costs.
Okay, I think that's it for that.
Okay, then we have the aging report. So the last 3 months, those are exactly what we've posted. We close out our financial software within the nursing home software by the 10th of every month. So those are pretty good numbers. It seems to be stable. We do have a few large balances that have new payment plans. And so we'll work through that, but there are a couple struggles, and that's nature and par for the course. We've been lucky not to have those in the past, at least right off. The billing staff are doing well, stable, and that's really great for the money part. They're well trained. My most recent hire was over almost 10 months now, so we're on track. I tell my staff that it takes about 3 years to really get good at what you're doing. And so Ashley has been here, I think, 1.5 years, and Lizzie 10 months. So we're making gains there, and that allows me to do other financial management rather than training. So they do get the chance to work from home. They come in and out as necessary. So there's always somebody in the office to help if they need resident fund money or something else. So we do have one staff in the office all the time, just for coverage. Any questions on the aging?
Don or Don or Larry?
No.
Okay, I do, and I apologize. I probably should have done this before. Sometimes it seems like I understand something and then I look at it again a month later and I'm saying, what's going on? Could you look at the aging report and explain it to me? Maybe look at the one that goes, the top one on the sheet. That
Okay.
goes August through January. The transaction amount, what does that represent?
Transaction amount, that's how, like many transactions we've done that month, the billing in, the billing out, and the money in. So if we run this let's say August was 169. So we billed out, I think August had a higher census, so we billed out more. And then we got more in. If we get a lot of money in, that's a transaction. So it's not a great guide, but it does tend to go more toward our census, meaning how much did we bill out, how much did we take in? The lower number would mean our census is down. We're not billing out.
So for example, on that one, we billed out 1,629,000 approximately. Is that the number I'm looking at?
Approximately, yeah,
Okay, and then in August, what's the $883,000?
883, the August. That's what is outstanding for
Okay.
August transactions. So in August, at the end of August, we would have Medicaid that's not paid. We would have Medicare that's not paid. Self-pay turns around pretty fast. We bill in August, we get the money in August. So that would show that that we've gotten that in.
So going down to June, for example, at 115,000. So is that 115,000? The amount still owed from June
Mhm.
in August?
Based on the service state
Okay,
that-
okay.
that we've established. Yep. So the June, that would probably be the Medicare money or the Medicare co-insurance, because it takes a month to bill Medicare and then another month to get the co-insurance in. And then if there's a self-pay amount on top of that, it's a third month. We can't bill every week on the room and board. We bill once a month.
Okay, and so if we were to go, that's the top one, August to January. If we were to go to the middle one, then the May and April, all those things, they're different because things have been paid. Is that,
Correct.
okay, okay, I think I got it now, and I hope I can remember it for another month. Thank you, Jane. for
You're
explaining
welcome.
that.
Yeah.
I also have another question for you and kind of a comment so the rest of the people know. The income statement that you put out, I don't know if I mentioned this last time, but you have to populate that by hand every month. Is that still correct?
That is correct.
So this does not just go from SAP. She has to actually put this in every time. And we had discussed maybe there's an easier way, and have you thought about that a little bit? But by the way, thank you for the bottom, making it a little bit easier to see
Oh,
what's happening with the depreciation and everything else. Appreciate you doing that. Well, you can answer that, or you can just keep thinking about it. And certainly we're open to an easier way for you to do it so we can get the information.
well, we do have a plan. I don't know if many of you have seen other department financials, the new look that Beata has created. She has a template that she can use for every department, and we're rolling it out gradually. And we're finding some issues in the SAP software that prevented us from launching that this month. So we're getting those issues resolved. It's mostly like purchase orders that we're combining with our expenses. So our expenses would, if we had used the new format, the expenses wouldn't be accurate. Hopefully the January numbers, when we start in January, that would be the February meeting, we will use that new template. And Carmen has reviewed it, and we could give you a sample, hopefully. Well, next month is January. We'll try it for next month. And maybe do both side by side to see what your thoughts are, and if you want the data in a different format, or more data, less data, we'll go for it that way. But yeah, we're working on that, and I think it'll be a nice format. It'll be consistent with the other departments. And you can give back give our feedback, and then we'll adjust it from there.
Okay, and it will be easier. You won't have to type everything in every month.
That is true, and it'll be projection based. So we'll do projections for year-end projections at the right-hand column every month. So in January, we'll project, as best as we can. Toward the end of the year, you get a little better at knowing where you're going to end up.
Okay, thank you. Good job as usual. Any, Don or Sean or Larry, any questions, general or specific?
No,
Just. Thank you.
Would you like me
Good
to
work.
go over the financials, or
Sorry. Pardon me?
would you like me to go over the financials? Any highlights?
Yes.
Okay. So what I can get from this as far as the highlights is, in October, we were $200,000 off in our revenue because of census. So we, of course, our revenues are going to be down year to date. So that's obvious there. Senior meals are still going strong. If you do the revenue versus expense, it looks like we're making money, but the overhead, a lot of those other items are not included in that cost. So we aren't making money on senior meals. We're probably breaking even, which is
Jane,
okay.
the overhead is included in that cost. It's included in the cost that we put out there to them. We budget that into that.
We have, there's the indirect costs and there's some others
Yeah.
in there too. Yeah. So it's, some of it is in there, right? But they're doing well. And I think another highlight is the social services line. When you look at that, we're still, Carmen has 2 social workers instead of 3. So she is trying to limit the overhead costs as best that she can. But our overhead costs are still going to be what they are, which is a higher percentage of our per day expense because we have fewer days to divide it over. The therapies are still about at the same expense. When we have lower census, they're able to do, I think, more outpatient therapy on the residents that aren't Medicare A. So that has been a healthy revenue source as well. At the very bottom, and this is just as of October, and there's a lot of ins and outs and estimates, and nothing is final. I did the October 31st projection and year-end projection. The first line is a loss, just a raw number, which isn't accurate at all because we have a lot of other things going on. We have depreciation taken out, which is not a cash item. And then we have the bus fund money, which is included in the revenues above. So that's not an operating cost. Provider relief funds of $307,000 was transferred in November. And so that will show up on the next month's financials as revenue. They call that not operating revenue, but truly it does offset our operations. That's the last money of the provider relief funds that we have. And that comes down to a net of a $700,000 loss, but that's not the end of the story because we have Medicaid rates that haven't been determined yet. That will go back to July. So we expect an increase there. And our supplemental payments have been estimated as revenue. They might be coming in a little bit lower than we estimated. The supplemental payment is the amount of money that the state gives to county homes to make up the losses, because they know Medicaid doesn't pay enough to keep the doors open. So at the end of the fiscal year, or the beginning of the next one, they parcel out the funds to try to make us whole as best as they can.
So, and I can add a little bit to that because a lot of this information came out after this agenda came out. So I probably would have put it as a regular agenda item, but it also fits into the financials conversation. So every year, as Jane mentioned, we get this supplemental payment. It normally comes in 2 installments, one in December and then one in July. So this one that we receive in December is called the interim supplemental payment. We can elect to not receive it in December and receive all of it in July, but we always just elect to receive half of it now and half of it later. It did come in lower than we normally would see. But that is also primarily because of the rates not being set yet. So they're kind of putting, one thing that's normally comes later earlier, because of the rates not being set, it makes it hard to set the supplemental payments. But they're doing it because they have to have it done before, the end of the year. So, they're a little bit off. But hopefully they'll all be adjusted once all of the rates are set after the beginning of the year. That was what actually, Chairman Kinnear had mentioned earlier of, me being on a call with the other county homes. That was specifically because of the supplemental payment issues. The Leading Age Wisconsin Finance, Vice President of Finance, had called the meeting of all the county nursing homes to discuss that because, they look very different than normal. And there's some kind of out there outliers of some counties that got very high increases in supplemental payments, some that got very big decreases. Fortunately, ours was not drastic, but it is lower than what we were anticipating. And then in terms of our rates, the state had said that we were supposed to be getting our rates this month. Then they said about half of the nursing homes would get their rates and half would get an interim rate. We were actually on the list to get our rates. Those were supposed to come out last week. And then when they put them through their rate modeling or module, whatever system they have that puts out the rates, there was some sort of glitch or error in their system. And now they said that there is no way that the rates are coming before the end of the year. So we are now also going to get an interim rate, similar to half the nursing homes that already got their interim rates. So it's not accurate. It is just based on their assumption of what the rate was going to be. So it's not directly related to our cost report, which is how rates are normally set. So we're kind of up in the air on what that's going to be. Then once the cost reports are all done through the state auditors, we will get an adjustment again. It'll just be after the first of the year. So we will know what that interim rate is on the 26th, and then we'll actually get the back payment through July on the 29th. So right before the end of the year. But so it is good news that we will have more money for the Medicaid rates than what we're currently getting, backdated to July as of the end of the year, but it most likely will not be the correct amount as it's not based on our cost report. So more to come on all of that.
So y'all got that, right?
And if I could add, if they give us our rates, then we can post that in our subsidiary ledger and post it as revenue. If they just give us the money, like they've done on some claims, they've just added money and then they found out, I guess, that it's not exactly correct. So we are sitting on some money that's been paid, but we can't post that as revenue because we just don't know what it is. So it's not applied. If they pay us on the 29th, the money may not get here till the first of the year. In that case, it'll hit the January books. So all the ins and outs of the money cycle, and we just keep following what's going on. And it's nice to have the money up front when they increase the Medicaid rates, which will, of course, reduce our supplemental, because we won't be, well, the idea is that we won't have so many losses, but then with the staffing issues, we do have losses. So maybe the supplemental payment will even be higher. Who knows?
Thank you, Jane. Is that it?
That is all I have.
Well, I'm glad you're able to zoom in today. We miss having you in person, but you do a nice job explaining over Zoom also.
Well, thank you.
Oh, there's
Like
one more update, if I could. We're going to be working with a new audit firm this year. So our audits may look different next year. We'll be working hard to adjust to that change. But our Medicaid cost reports, they want them early, but they won't. So we'll go through this again next year with the state of not having rates, I think. is because it's a gap.
Supervisor Breslin,
Yes.
you were make a comment, but we couldn't hear it because we had two people on at once.
Oh, no, it's just, I prefer to be in. The Zoom is nice though, so. I'll be in council next month.
Great. So then I think we need to have a motion to accept the vouchers and financial reports.
That's a motion.
Supervisor Breslin moved,
I'll second.
and Supervisor Keeter second. I don't think there's any discussion. All in favor, say aye.
Aye.
It passed. And great, next meeting is, would that be the 19th, I think?
The 26th.
26th.
This one was, oh, sorry. It'll be the 26th. This one was a week earlier than normal, because we canceled November's and then made this one a week earlier. So normally it would be the next week's. So the 26th of January.
Oh, so we're the fourth one.
Yes, fourth Thursday
Okay, and,
at 9.
okay.
Mhm.
At 9. Anything else before we sign off?
Can I ask one thing? When
Yes.
do we generally set the next year's meeting schedule? For 2023?
We were asked to do it. We can change it if we need to. I know we just did for the PRD.
Yep, I'm just asking so I can get the public website updated for the neighbors committee, if we're keeping it the same or.
Oh,
Yeah, might as well keep it the same. The
Okay.
fourth Thursday works good.
Okay.
Supervisor Bjork, that Supervisor Keeter?
Yeah, I'm okay with Thursday. It'd be nice if it could have it a little later. But I'll do it. Yep.
Okay. Okay, then the next meeting is the 26th at 9 a.m. right here.
Sounds good.
We are adjourned then. Thank you, everybody.
Thank you.
Thank you.